Dr. Gulani, back today for my follow-up for my last surgery, and just had a couple questions for you that on a busy Monday like this, how do you have time to deal with somebody like myself? Because I've been through a lot, and it was pretty much hopeless, my case, but you still have the time to sit down with me. I've had so many appointments with you, and you've been so nice. He doesn't rush you through anything, and he really helps you get to where you're at. So my question is, like, with all my cuts and my RK surgeries and my hexagonal surgeries, how did you know even what type of lens to use?
First of all, officer, great seeing you. Never say, how do I deal with? It's a passion. I love it. Like I said, seeing you all come back. Today is Monday. As you see, patients are landing from all over the world with complex cases, RKs, keratoconus, LASIK complications, and then my own Mona Lisas are coming back, so it's a pleasure.
Oh.
And I love your enthusiasm. You wanted to share some questions online for other RK people. Always my pleasure. I try my best to give as much, and then you guys know so much, because how many times do I measure you before surgery?
Many.
Hours.
Many.
So, to answer your question, yes, you had nearly 40 cuts, not only with your radial keratotomy cuts, but astigmatic cuts and also hexagonal cuts.
Right.
Total cuts everywhere. But as you know me, you're a police officer. I don't look at the difficulty, I look at the potential.
Yeah.
I looked at you, dynamite personality, struggling, and I was like, no, I need to fight for him. So we took the steps. How many times measured you, look for fluctuations, etc. And then we did your surgery, the cataract lensoplastic based cataract, and landed straight at vision. How are you seeing today?
I'm saying great. I mean, no glasses, no nothing. I'm driving fine. I can see distance. I can read that I couldn't do before. I had to wear big magnifiers. So you've given me freedom back that I haven't had for 35 years. So,
pleasure. So yes, your cases are difficult, Don. One is the number of cuts I have to get into. I have to see through them to operate. On top of that, you have fluctuations of measurements. No machine can measure you. So all these are difficulty levels, but all of y'all keep on inspiring me to keep going ahead. That's it. So for doctors watching, what did we do? And lens implant. Remember, there's a lot of hype and advertising of lenses, and please don't fall for that. Think about it. Your RK cornea, radial keratotomy cornea, is permanently damaged, right? It's got permanent cracks in the windshield. No particular lens can make you see. Now, if a lens made you see, it means you are so simple in your RK cornea, you're pretty much a normal eye. That's why I pioneered lensoplastic, where using lens technologies, again, thank God, majority of our patients see without glasses. And in some rare cases where they have additional problem, that they had some wrong surgery somewhere else, I reverse that with a stage 2 laser plastic. My whole point is you got to manipulate your optics through surgery, but through surgical artistry. Was there any pain in surgery? How was your experience in that, Doc?
There was no pain. I mean, that's what I wanted to tell everybody. Don't be afraid to come here, because you've got an outstanding surgery center, one that I've never seen before. It really puts you at ease. And to go through the surgeries that I went through without anything other than numbing drops is absolutely amazing. That's a miracle. I mean, so don't be afraid to come to see Dr. Gulani. It was amazing. Your staff is amazing. Your building here is amazing. Your outpatient surgery center is amazing. I have no complaints whatsoever. None whatsoever.
An honor. And then seeing you all back into your lives, huh? What options were you given before coming here?
The only option that I had was corneal transplant in both eyes. And if I didn't do that, they said live with it. And I couldn't do that. I couldn't do that.
Sure. So yes, you all are difficult cases, radial keratotomy patients. Yes, you all are difficult to even measure on top of that fluctuation. But all of you can be helped. That's the point. And I appreciate when my patients ask me questions and wanted to go online. And this is impromptu, like always at Institute. Nothing, no script, no teleprompter. And it's important that when you're all listening, please understand these things. Do not fall for advertising of lens implants. Majority of these patients fly to us very disappointed, disgruntled, angry with their surgeons, and now they want those lenses removed. So it's very important, please, be careful going in. Yes? Ask for experience, ask for results, ask for more than 1 or 2 patients that you can see. Do your due diligence. You're pretty smart. You did your diligence without computers in the arcade days, correct?
Right.
So now it's so easy. You can go online and really find out the experience of doctors. And I'm sure every doctor does their best for you. but do your diligence, especially with your RK scenario. You want to know, what if something goes wrong? Does that doctor or facility or a practice have the ability to fix things? What is the reputation there? So is there advertisement going on? Is there real stuff? Small things. Find out, because we see so many patients who come here so disappointed with their surgeries from all over the world. You've seen these patients, right? Day one post-op. All of you share your stories from all over, worldwide, people who are here. And it's very important, do your diligence. There's no rush. Now, your RK was actually an easy surgery, but doing lensoplasty, going inside your eye, is more difficult because you're aiming for an abstract outcome. But it's possible. Then the whole gamut of things, right? Your tear film needs to be corrected with moist therapy. The lens-based lensoplasty, cataract surgery, laserplasty to fix your scars on the cornea. Remember, new carpet on broken tiles. Your ability to even cross-link in the future if needed. All these come together. Your corneal techniques, corneoplastique. The doctor has to know all of this to be a master chef to address your eyes uniquely. Very, very important. Does that make sense, Tom?
Makes a lot of sense.
And then, of course, commit to the patient. Look at them, look at their persona, personality. They should not be told live with it. And yes, I'm human, I could make a mistake too, but the fight continues for them with ethics and commitment.
One other thing I wanted to say is Dr. Gulani gives people hope, because most of the people, all the people that I've spoken to over the last several months, they were at the end of the line. They had no hope. And so they all came to Dr. Gulani. And I have to say, he's a visionary, he's a master of what he does, and he can help you. And if he can't help you, he'll tell you he can't help you. But I haven't seen any patient come in here that had, worst case of me, one guy was blind, and he gave him vision. I mean, it was unbelievable. So don't be afraid to come here and see him, because he will give you hope again.
Again, my pleasure. Hope this helps everybody with RK and any other eye problem, because the concept remains the same. Officer, safe travels back. Been an honor.
Yeah, same time.
That's an honor.
Good to know you, Doctor.